is our public service announcement for fetal alcohol spectrum disorder. Sensory processing disorders occur when the sensory systems and the brain do not communicate properly. The result of improper communication can lead to problems which affect the various sensory systems, including the vestibular, proprioceptive, tactile, auditory, gustatory, and visual systems. Sensory information that is coming in from the environment is perceived abnormally, resulting in a miscommunication between the brain and the various sensory systems. Due to the miscommunication of information, the individual may exhibit behaviors which cause them to be hypersensitive or hyposensitive to sensory stimuli in specific situations. Fetal alcohol syndrome is a condition that occurs when a child is exposed to alcohol during the mother's pregnancy. It typically occurs in 1 in 100 births. Fetal alcohol spectrum disorder includes fetal alcohol syndrome, alcohol-related neurodevelopmental disorders, and alcohol-related birth deficits. The criteria for this disorder is facial abnormalities, such as the individual having a thin upper lip, an elongated, flattened midface, or small eye openings. The individual might have central nervous system disorders, such as developmental delays or intellectual delays. This disorder can be confirmed through an MRI of the baby's brain. Some of the functional problems noted include physical abnormalities, such as the individual having limb growth abnormalities and small facial features, which may cause functional problems with eating and breathing. The individual might also have executive functioning problems, which include trouble paying attention, trouble staying organized, difficulty with regulation of one's emotions, and difficulty with self-monitoring. The individual might also have social problem-solving problems and might exhibit inappropriate social interactions with their peers. Some intervention ideas include keeping instructions short and simple, establishing a structured routine, providing concrete hands-on learning methods, and using social stories to help facilitate proper social problem solving. Therapists might also provide the child with a multi-sensory approach to learning using visual, tactile, and auditory cues. The individual might also need a weighted blanket to help calm their bodies down when they are doing certain tasks, such as when they are in school learning. They can have a lap blanket to help calm them down if needed. Some of the precautions include signs of seizures, signs of sensory overload, and signs of sensory shutdown. Individuals with fetal alcohol spectrum disorder can also have heart, lung, and kidney deficits, so the therapist should be aware of these medical conditions prior to starting therapy on the individual. Signs of sensory overload include the individual being irritated and hard to calm down. Signs of sensory shutdown include the child not responding to anything that is placed in front of them, gazing, and again, not responding to anything that is placed in their environment. Here are some information and resources that an individual can go to if they want to learn more information about fetal alcohol syndrome and fetal alcohol spectrum disorders. And here are our references.